In this short video, we're going to have a look at the recovery position using a hospital bed or in a hospital or care home environment. The recovery position itself is reasonably simple, but there's a few things we need to look at before we actually put the patient or even start to put the patient into the recovery position. The first thing is all hospital beds and nursing home beds tend to be on wheels, which move around very, very freely on hard surfaces for easy cleaning, wheels so as you can move the bed for the cleaning purposes. So the first thing to do is to make sure the bed is actually stable, fixed in its position, and all the brakes are on all four corners. If you don't do this, as you start to roll the patient towards you, the actual chassis itself that the bed is on can move away from you, and then you can have a catastrophe as the patient falls between you and the bed, and we don't want to do that. So make sure the brakes are on. So bear in mind that most hospital and nursing home beds will have side protectors or guards to stop the patient getting off the bed when there's nobody there to supervise them, or to stop the patient falling off the bed if they're unconscious when they roll around in their sleep. So the first thing we need to do is to actually drop the side curtain down to allow us access to the patient. With the side curtain now dropped, I can get close to the bed, and you need to literally be touching the bed. We don't want any gap between me and the side of the bed that the patient can fall between. So you need to be close to the side of the bed. We then start the recovery position itself. So we take the patient's right hand. If you're on the left hand side of the bed, it would be the opposite way around. So remember, I'm on this side of the bed, I'm going to bring the patient towards me. We never take the patient away because we don't have any control of the patient. The patient could easily fall off the bed. I want to bring them towards me, so I'm totally in control. So we lift one hand and put it into what we call the how position, out of the way basically. The next thing we're going to do is we're going to bring the opposite hand across to the side of the face, remembering to turn rings round and anything that's sharp that might catch the face away from the patient's face. Place the hand to the side of the face and keep your hand to their hand. If I let go, the hand will simply fall back down again. So you must remember, once it's in position, we keep it in position by holding it that with my hand. The next thing, we go to the outside of the leg, lift the knee, and we use the knee as the pivot point. So once we've got the knee raised, we press down on the knee, the patient then rolls towards me. I control the head and I bring the knee round to stop the patient from falling over. Also remember, if there are any pillows or anything that's under the head, they should be removed because we don't want anything to occlude the airway, to stop any vomit or any liquids that we're trying to protect the airway from coming clear of the mouth. So once the patient is in this position, we stay in this position so they can't fall off, they can't move, and I must stay with the patient at all times. Anybody else will do any fetching and carrying, but while the patient is in this position, I'm in total control.